Here's a cool fact you're going to want to know if you're pregnant or you ever plan to be. They did a study in 2019 that showed that if somebody has a levator ani coactivation at term, meaning when they're ready to give birth, they have on average about 20 minutes longer during the second stage of labor. Now, what does this mean? When they talk about a levator ani coactivation, they're talking about the pelvic floor muscles, which sit at the bottom of your pelvis here. And ideally, they should be able to contract upwards towards the head. They should be able to sit at a normal sort of middle resting tension, and they should be able to descend and lengthen down towards the feet. Some people have a really hard time with this lengthening motion, but it is ideally what's going to be happening when we have a bowel movement as well as when we give birth. Now, what happens when we have a levator ani coactivation, what this means is when these women were instructed to valsalva or bear down or push down, rather than lengthening like it should have, their pelvic floor contracted instead. And this is something we actually see pretty commonly. Now, they did try to coach the women through this, but some weren't able to figure out how to descend their pelvic floor during that coaching. And for those women who were not able to learn how to descend their pelvic floor and maintained that coactivation, they had, in general, on average, about 20 minutes longer of second stage of labor during that active pushing stage. Now, 20 minutes may not seem like a lot until you're in labor. And also, generally, a longer second stage of labor can be associated with increased severe perineal tearing and an increased need for operative deliveries, things like forceps, vacuum, etc. Now, the study doesn't exactly tell us why these women had a longer second stage of labor, but the logical theory is that because those pelvic floor muscles weren't able to descend and kind of open up, we're creating almost a sort of what they call soft tissue dystocia, which is where those pelvic floor muscles kind of block the baby from coming down effectively. Now, we have 0 studies on this yet, but the next question would be, if we can coach women to relax and descend their pelvic floors, will they have an improvement in their time of second stage of labor? And we do already have some research that pelvic floor muscle training can help reduce the time of the second stage of labor, but we do need more research to say if we teach people to relax and descend, does that improve their labor? This is already something that a lot of pelvic PTs have been doing for a long time in their birth preparation. They have been teaching patients how to relax their pelvic floor when they go to give birth.